Hi, my name is Marta Zinyuk and this is Randall Crowder, and I'm recording a video assessment of the thorax, the lungs, the cardiac, and the peripheral vascular system. And this is an assessment for NU 650 Advanced Health Assessment. Randall, do you give consent for me to record this assessment for me to do this assessment?
Yes.
Okay, thank you. I will first start by washing my hands, and we'll make sure the patient is in the correct position, and he is sitting upright. Okay, Randall, do you have any problems breathing?
No.
Okay, have you had COPD, asthma, any lung issues before?
No.
Okay, I'm going to start by doing an inspection, and I'll put my hand on Randall to count his respiratory rate. All right, his respiratory rate is with a normal rate. It's about 16 per minute. Rhythm is normal, regular pattern. Respirations are deep, no retractions, no bulging. Chest is symmetrical. Interior and posterior ratio to the transverse is normal. Okay, no accessory muscle use. No labored breathing. The color of his skin is not cyanotic or pale, no redness, no lesions, obviously no cyanosis. The lateral diameter of his chest is symmetric, not barrel. Randall, do you have any pain or tenderness anywhere?
Nope.
Okay. The AP diameter is half that from left to right. Okay. Trachea is midline, and he is not in the tripod position. Okay. Randall, can you turn this way, please? Thank you. Okay, I'm gonna place my hand on under Randall's rib cage, and this way I'm going to feel for for the lung expansion. Okay, Randall, breathe in, out, again. All right, very good. The chest expands about 2 centimeters. My fingers are about 2 centimeters apart. Very good. Next, I'm going to test for tactile fremitus, and what I'm going to do is I'm going to do this motion. And Randall, while I do that, please say 99.
99.
Every time I tap?
99, 99, 99, 99, 99, 99, 99, 99,
Okay.
99.
Okay, that's good. Thank you. All right. The vibrations are equal throughout. There's no abnormalities here. Okay. I'm going to palpate and feel for any crepitus, crackling, or any tenderness. Do you feel any tenderness anywhere?
No.
All right. All right, now I'm going to do some percussion. All right, I hear resonance and no dullness. All right, Randall, will you please turn back around? Okay, thank you. So I'm going to grab my stethoscope and I'm going to go from left to right and listen to your lung sounds, okay?
Okay.
All right, breathe. All right, hear a nice hollow pitch, no adventitious sounds, no crackling. Okay, I'm gonna do the same thing in the back. All right, keep breathing. Okay, I did not hear any adventitious sounds, no crackling. Testicular softer. Put under your armpit right here. Okay. Turn this way a little bit. All right, so I'm just going to do a few special techniques now. And the first one I'm going to do is called agaphony. And Randall, you will say E every time I touch you with the stethoscope. Now, if I hear an A, that means there's fluid in Randall's lungs, which would not be good.
What am I saying?
You are saying E every time I touch you with a stethoscope. Okay. Go ahead.
E, 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 E.
Okay, next I'm going to do something called bronchophony. And Randall, will you say baseball every time that I touch you with a stethoscope? If I hear any consolidation, it would mean that something like pneumonia is possible. Randall, okay, go ahead, start saying.
Baseball, 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 baseball.
Okay, Randall, next what I'm going to do, it's something called whispered pectoraliqui, and every time I touch you with the stethoscope, can you whisper baseball?
Baseball, 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 baseball.
And sometimes, very good, Randall, sometimes when there's consolidation, the sound will be much louder even though he's whispering it, but with the stethoscope and listening with the diaphragm, it will be much louder. Okay, very good. Randall, now we're going to do a cardiac assessment, so will you please lay down?
On my back?
Yes, on your back, please. Okay, and Randall's head is 30 degrees, lifted 30 degrees with the pillow. Okay, very good. Okay, I will start off by inspecting for jugular venous pressure and any carotid pulsations. Okay, I don't see any. Okay. All right, I will go ahead and auscultate the carotid artery for presence of any bruits. Okay, I don't hear any. All right, I will palpate the carotid artery, of course, one at a time. Okay, it's nice and strong. Okay, I will palpate the anterior chest wall. Okay. No heaves, no lifts, no crepitus. Do you feel any tenderness? No? Okay, very good. Okay. Then I will go ahead and palpate the PMI, noting the location and the amplitude. And this is at the 5th intercostal, right here, about 9 centimeters from the sternum. And I should feel a small tapping. Okay. All right, next I will go ahead and auscultate the interior chest with both the diaphragm and the bell of the stethoscope. And I will do this in a ladder way, starting from left to right. And first, this is going to be with both the bell and the diaphragm. So first, I will start the aorta, which is at the second intercostal space. Okay. Right, next is the pulmonic, which is also second intercostal space. Okay. Then I'm going to go to the herbs point, and that's third intercostal space. And tricuspid, that's fourth and between the fourth and fifth intercostal space. Okay, and then the mitral area. Okay, I don't hear any murmurs. Very good. And Randall, will you sit back up, please? Okay, and the way I completed the auscultation was I went from, actually let me do it while you're sitting up as well. All right. Okay, so the aortic, the pulmonic, the herbs point, tricuspid, and then the mitral. And I do not hear any murmurs. Okay, so next I'm going to auscultate for aortic regurgitation while Randall is sitting up and leaning forward. Okay, lean forward a little bit. All right, I need you to exhale completely. Okay, and then briefly hold your breath after expiration. Okay, very good. All right, next I'm going to do the peripheral assessment. Randall, can I see your hands, please? All right, I'm going to do Randall's, feel for Randall's radial pulse first on both hands. All right, brachial, epitrochlear, which I definitely don't want to feel these. Okay, right on the armpit here, axillary. Okay, very good. Okay, next I'm going to estimate the width of the abdominal aorta, knowing for any presence of a mass. All right. Okay, and that's within normal limits here. Okay, very good. Okay. Okay, Randall, can you please lay back down? Okay, and just to check again for the abdominal aorta, Looks like it's about 2 centimeters, and it shouldn't be more than 3. Okay. Okay. I'm gonna feel for the. Okay, I'm gonna feel for the superficial inguinal lymph nodes. Okay. Okay, sorry, I'm just gonna move your pens down a little bit. Okay. Okay, very good. All right, anything tender, Randall?
Nope.
Okay. All right. I'm going to check Randall's feet here. Okay. All right, temperature is the same on both legs. Okay. Within normal limits. His hair is evenly distributed. The color is even and symmetric, no varicose veins, no scars, lesions, no ulcers. I'm going to palpate the femoral. Okay. All right, very good. Next, I'm going to palpate the popliteal, and this is behind the knee. Okay, so Randall, I'm just going to feel behind your knee. Okay, very good. Then I'm going to palpate the dorsalis pedis, which is right here on top of the foot. Okay. And the next is the posterior tibial pulses, which is right behind the foot right here. All right, I'm going to palpate for any peripheral edema and venous tenderness, and I will go ahead and do that by seeing if my fingerprints will stay in in Randall's foot as I press. And then letting go. Okay, no, my fingerprints do not stay. Okay, so Randall does not have any edema. Okay, Randall, will you go ahead and sit back up, please? All right, and the next and last part of my assessment is I'm going to push on Randall's radial and ulnar pulse. On Randall's radial and ulnar artery, and I'm going to count to see how long it will take for the color to turn back. Okay, so can I see your hands? All right, can you do this with me? Yeah. Can we let it go? All right. You're normal. All right. Thank you, Randall.
Thank you.